Hi Derm Babes, and welcome back to my channel. Today we are diving into a topic that affects millions of people around the world, eczema. If you or someone you know is dealing with this skin condition, you're in the right place. If you're ready to discover the keys to managing eczema, understanding the triggers, and understanding treatment options, you're also in the right place. Don't forget to hit the like button, subscribe to our channel, and share this video with your friends and family who may benefit from this invaluable information. Hi, my name is Dr. Nana Bawachi. I'm a board-certified dermatologist based in New Jersey, and I have a teledermatology practice where I see patients in multiple states. I'm also a lifestyle dermatologist because I truly enjoy educating and guiding my patients on how lifestyle impacts your skin health. Atopic dermatitis or eczema affects about 31 million individuals in the United States of all races and ethnicities. It is the most common in children, but it can be seen in adults as well. It's a chronic inflammatory condition where the skin barrier is compromised, and thereby individuals develop dry skin, skin lesions that affect the flexural areas, which are the backs of the knees, the inner elbows, wrists, and at times, individuals are prone to infections. Some of you may be familiar with the atopic triad, which includes atopic dermatitis, allergic rhinoconjunctivitis, and asthma. The etiology of eczema is complex and includes genetic predisposition, immune dysregulation, skin microbiome abnormalities, and environmental factors that compromise the skin barrier. Genetics plays an important role in eczema. In certain cases, there's a loss of function mutation in filaggrin, which is a protein in the epidermis that helps with a natural moisturization factor. If there's a mutation in this protein, it can lead to other skin conditions such as ichthyosis vulgaris. Since the skin barriers weaken, the skin becomes dry. Environmental irritants and aggressors cause inflammation, which then leads to an intense itch-scratch cycle. Earlier, I discussed the presentation of eczema. The classic presentation in infants are swollen patches with the crust on the scalp, face, and extensors, and it's rare to see it in the diaper area, whereas children have the lesions in the flexural areas. And in patients of color, there is a greater propensity for follicular accentuation, lichenification lesions, and pigmentary changes on the extensors. One of the most stressful symptoms is the eczema itch. The itch has a significant negative quality of life and can lead to sleep disturbances and ultimately affect mental health by increasing anxiety and depression. It is key to break the itch-scratch cycle by reducing the likelihood to itch by using skincare products that have ingredients such as colloidal oats, ceramides, or hemp seed oil. When it comes to the management, daily skincare is imperative. I recommend patients to use creams that have emollient, humectant, and occlusive ingredients. I also recommend products with ceramides because they help restore the barrier. I recommend applying the moisturizers twice a day and sometimes more if you're having a flare. When showering, use lukewarm water and pat dry. Anti-inflammatory therapy is very important in the management of eczema. Topical steroids have a bad representation, but they are great for a short period of time. Other treatment options include non-steroidal topicals such as crisaborole, tacrolimus, and new medications called JAK inhibitors that have shown great efficacy. JAK inhibitors are also common in oral form, and biologics, which are injectables, can also be helpful. Lastly, phototherapy is another great option. Regarding holistic treatments, I usually recommend that patients take a probiotic to help improve their gut health. Research has shown that there's a link between gut health and eczema. A healthy gut contains a variety of good bacteria that help to keep the immune system healthy. When the gut is out of balance, it can lead to inflammation. So how do you improve your gut health? There are a number of things you can do to improve your gut health, including eating a healthy diet that's rich in fruits, vegetables, and whole grains, taking a probiotic supplement, avoiding processed foods, sugary drinks, and excessive amounts of caffeine and alcohol. So let's talk about wet wraps. Wet wraps are a type of therapy that involves wrapping the affected skin in damp cotton clothing or gauze. Wet wraps help to hydrate the skin and reduce inflammation and itching. So how do you perform a wet wrap? Follow these steps. Bathe, shower for 5 minutes in warm water with a pH balance cleanser. Pat dry, then add the prescription product to the affected areas. Apply a liberal amount of moisturizer on your entire body. Soak a cotton garment or gauze in warm water. Apply the wet garment or gauze to the affected skin. Wrap a dry layer of clothing over the wet layer. Leave the wet wrap on for 2 to 3 hours or overnight. Remove the wet wrap and apply moisturizer. So these are some pro tips for the wet wraps. Use soft, absorbent cotton clothing or gauze. Avoid using synthetic fabrics because they can irritate the skin. Make sure the wet wrap is comfortable but not too tight. If the wet wrap becomes too dry, re-wet it with warm water. If you experience any discomfort, remove the wet wrap immediately. Another treatment option are bleach baths. This treatment option is a standard of care when it comes to treating atopic dermatitis because it's able to reduce disease severity by reducing itch and improving the skin barrier dysfunction. Interestingly, the actual mechanism by which this does this is unknown, but it's an important tool in the eczema toolkit. To do a bleach bath, follow these steps. Fill a bathtub with water. Add a quarter cup of unscented bleach to the bathtub. Soak in the bath for 5 minutes. Rinse thoroughly with water, pat dry, and apply a moisturizer. Here's some pro tips for bleach baths. Use unscented bleach because scented bleach can irritate the skin. Do not add any other products to the bath. If you experience any discomfort, remove yourself from the bath immediately and talk to your doctor before doing this. I've covered a wide array of information related to the presentation of eczema as well as the treatment options. Remember, eczema is a chronic inflammatory condition and it can be challenging to manage. Keeping the skin moisturized is important to supporting the skin barrier, especially during the maintenance period. Thank you for spending your valuable time with me today. And before I say goodbye, hit that like button if you found this video informative and engaging. Subscribe to my channel for more insightful content on skin health and other related topics. Don't forget to ring the notification bell to stay updated on our latest uploads. Share this video with your friends and family who could benefit from this knowledge. And last but not least, comment down below with your thoughts, questions, or suggestions for future topics. By doing these actions, you're not just helping us grow as a channel, but you're also helping others who might be seeking answers on eczema. Together, we can build a supportive community dedicated to healthier skin and overall well-being. Remember, radiant skin is a lifestyle.